right. So let's just give people, they're coming on. Before we get started, welcome everyone. Thank you for joining us. We'll get started in just a little bit. Let's just let people get in and then we'll get started with today's presentation. It's like the numbers are ticking up. So that's good. All right. So we'll go ahead and get started. Good morning, everyone, and thank you for joining us. This is being recorded and we'll be posting this later on our YouTube channel and our Facebook page. So please feel free to check that out later or share it with others that can benefit from this information. My name is Aurelis Cortez. I am the event coordinator here for Turning Point. Thank you for taking time to be with us today. We are going to have a Q&A session as time permits towards the end of today's event. So if you do have any questions, we ask please that you type them in the Q&A box. And at the end, as time permits, we'll make sure that those get answered. Before I turn it over to Deb, our presenter, as a reminder, Turning Point is a 501c3 nonprofit that depends on community support. We have some amazing socially responsible partners that includes local businesses and individual donors that make possible that we bring these events to you without charge. So we are grateful to them. A little bit about Deb, about our presenter today. She's an associate professor at Oakland University, teaching in the Doctor of Physical Therapy program. She's also the department chair for the Human Movement Science Department. Dr. Doherty co-developed the Graduate Certificate in Oncology Rehabilitation at Oakland University, an international program teaching physical therapists how to treat patients diagnosed with cancer. She's a frequent lecturer to healthcare practitioners and survivors on the importance of oncology rehabilitation. She's also a member of Turning Point's global outreach initiative to increase access to care for undeserved women and men with breast cancer, and is leading a partnership with Oakland University and Turning Point that reduces barriers to survivorship care in Detroit. She's also a 15-year breast cancer survivor. So without further ado, we're excited to have you with us, Deb, and the Zoom is yours.
Thank you so much. I just greatly appreciate this opportunity to present this information, but to join with you. Yeah, Turning Point is such a wonderful organization doing such great things for patients diagnosed with cancer. So thank you for the opportunity. So I will share my screen. Can you see it? Are we good?
Yes. Yep, we're good.
Okay. So thank you, everyone. I am so thrilled to be here and talk to you about this particular topic. This topic is so near and dear to my heart. I really believe like this is one of the next places we're going to go, not only as survivors, but as medical practitioners, healthcare practitioners in preventing cancer and preventing the recurrence of cancer and the adverse effects that can come from cancer. So the topic is called the role of chronic inflammation in cancer and lifestyle behaviors to decrease your risk. Okay, the intended learning outcomes. I just want you to think about what chronic inflammation is. We'll talk about it, define it a little bit, understand how inflammation affects cancer development, and then understand lifestyle behaviors. This is the best part of what we can do to not only prevent inflammation, but to prevent cancer, but also to improve our quality of life.
Hey, Deb.
Okay. Yes.
Real quick, I'm not sure why, but there's a lot of static all of a sudden when you're talking. I apologize to interrupt you. I'm not sure. It wasn't like that when we got on. I'm not sure what's going on, but I just wanted to. I don't know. I'm sorry. I noticed it. I thought it might just be on my end, but some of the participants mentioned the same thing. So.
I mean, I don't know if I move around a little bit in my room. If that would help, you think that would help? I want you to understand the power of inflammation. Inflammation causes cancer. Cancer causes inflammation. The different treatments for cancer cause inflammation, and they're less effective if a person's body is inflamed. Inflammation causes obesity. I'm going to talk about this later too, but inflammation is what causes obesity. We don't hear that from our medical practitioners. Obesity causes inflammation. There are 13 cancers that are attributed just to obesity. Inflammation decreases the immune system function through leaky gut and leaky brain. Inflammation is a contributing factor in a lot of the adverse effects from cancer treatment, like lymphedema and fatigue and polyneuropathy and chemo brain and other things. Insomnia causes inflammation, and inflammation causes insomnia, and inflammation affects our mortality. So I really want you to go home with the idea that inflammation is really one of the most important things we can work on and deal with to make our lives better. Now, I am going to bring a little bit of research into this. I don't expect you to pay a lot of attention to these chemical mediators, only to understand that there are tests to test for inflammation. This is where we need to go next, not only as healthcare practitioners, but as advocates for ourselves as cancer survivors. We need to ask our physicians to start getting us blood tests to test our inflammatory markers. We can test for so many things and follow it. So for example, 15 years ago when I was diagnosed with breast cancer, I had read some articles about vitamin D and how they were still trying to decide if a low vitamin D caused cancer or it happened because of cancer, but it truly was a part of the picture. I took those articles to my oncologist, and he, of course, then ordered a blood test to find out if my vitamin D was low. It wasn't part of standard of practice and still isn't, sadly. My vitamin D was almost non-existent in my body. So from that point on, I started taking vitamin D supplementation, making sure I got out in the sun in the summertime, and I have it tested every single year. That's how I follow it. And that is one of the things I can do to help prevent some of the problems that occur with a low vitamin D. Well, now we can do the same thing with inflammation. This is truly on us as well. We have a lot of responsibilities in this to make sure this happens. So there's numerous tests, and there's lots of research out there that will show that it can be done. So why do we as survivors care? There are lifestyle behaviors that we can participate in and that can decrease our inflammation, and we can have it measured every year to make sure we're doing the right stuff. And if it's not going down, we know we have to do something different. We can improve our quality of life, improve the longevity of our lives, and decrease the risk of recurrence of cancer through decreasing inflammation. Now, we do want to understand what's the difference between acute and chronic inflammation, because there is inflammation that's great. Acute inflammation is good. So acute inflammation is when our bodies respond to a physical or chemical insult. You know, if I cut my hand with a knife while I'm cleaning vegetables, I'm going to get some inflammation. I want that to happen. I want that process to occur. It's rapid onset. It lasts for only a few days. And there's 3 different lines of defense for inflammation to improve the area of injury. That's the kind of inflammation we want. When we have an injury, we want the body to take over. The first line of defense is the skin. Our skin is a great physical barrier, keeps pathogens out, even, the areas that are open, like our mouth and our eyes. And, there's all sorts of saliva and mucus and tears and enzymes that can break up bacteria or other pathogens that get in. But if we open that up, as in injuring our skin, then we need to go to the second line of defense. That's when the inflammatory process starts to take place. We have increased blood to the area. The blood vessels expand. White blood cells go in there and they try to eat up and destroy whatever's in there that shouldn't be. And the acute inflammation can cause redness, heat, swelling, and pain. That's a good thing. That means it's working. And it turns off when it's no longer needed. That's the difference between acute inflammation and chronic inflammation. Acute inflammation goes in, does a job, goes home, turns it off when it doesn't need it. The third line of defense that is still really good within our system, though, with acute inflammation is what is happening throughout our body. So the first and second line of defense is very local. The third line of defense is throughout the body. This is where we have our two types of white blood cells, the B cells and T cells, and the B cells are in there making antibodies. So you've heard about this. I'm sure you have some pathogen in your system that's a bad cell, and we make antibodies to fight that, mark it so that it can be destroyed by other cells. And then the T cells come in, they help more B cells to be made, but there are also killer T cells that go in and grab those foreign invaders. Again, that's what we want to happen. So this acute stuff is great, but what happens in chronic inflammation is when it doesn't turn off. When for some reason our body is constantly going through the inflammatory process, it never turns off. It keeps our body inflamed the whole time because our body is trying to fight what it thinks is a foreign invader when it isn't. So this systemic inflammation gets turned up too high. This is slow onset. It's over duration of months to years, and the long-term outcomes are tissue damage, organ damage, sometimes tissue death, thickening, scarring of connective tissue, and organs that don't work well anymore. It's like the body is under consistent attack, and the immune system keeps fighting by continually pumping out white blood cells. That's where the problem is. So the chronic inflammation is what can cause so many problems, but we have some control over this. So what are some of the risk factors for chronic inflammation? Well, age, that's one thing we can't change, but knowing, when we have the knowledge that we know we're aging, what can we do to help keep everything else great so that we don't get that chronic inflammation? As we already talked about, obesity causes inflammation, inflammation causes obesity. Diets rich in saturated fat, trans fats, refined sugar cause inflammation. Smoking, of course, stress, poor sleep habits, all cause inflammation in the body because of the chemical changes that occur in our body. And low sex hormones can also cause inflammation. So low testosterone, low estrogen. Now there are diseases that cause that to happen when it shouldn't be. We know, again, as women with aging, that we are going to have lower estrogen as we age. Again, knowing that, knowledge is power. We know how we can work around that to keep our bodies strong in other ways. Some of the symptoms of just chronic inflammation in general: body pain, joint pain, muscle pain, fatigue, insomnia, depression, anxiety and mood disorders, weight gain or loss that wasn't planned, frequent infections, gastrointestinal complications like constipation, diarrhea, acid reflux. These are some of the body's signs that there's inflammation in the body. So I want you to think about it differently. Instead of just necessarily popping a pill thinking that'll take care of it, these are areas we need to look into more. Talk to your physician, talk to your physical therapist, talk to other healthcare practitioners about how we can go in and not just put a Band-Aid on it, but let's fix it so that it decreases that inflammation that it could be causing in our bodies. These are signs that there's inflammation in our system. What we do know, and what the research greatly shows, is that chronic inflammation is associated with cancer and heart disease and metabolic syndrome and non-alcoholic fatty liver disease and type 2 diabetes and obesity and asthma and gingivitis, rheumatoid arthritis. There now is huge research about Alzheimer's and inflammation. So keep in mind, when we talk about inflammation, although we're thinking about it on the basis of preventing cancer or preventing recurrence of cancer, when we prevent cancer or recurrence of cancer, we're also preventing all these other diseases as well. We are helping every organ system in our body when we decrease inflammation. Wow, a 2 for 1, 3 for 1, 5 for 1. This is a great investment in your body for what you're going to get out on the other side. The World Health Organization says that chronic inflammatory disease are the most significant cause of death in the world. 3 of 5 people die due to chronic inflammatory diseases like stroke, chronic respiratory disease, heart disorders, cancer, obesity, and diabetes. We can help ourselves, though. There's things we can do, but we can't do it if we don't know how to find out if it's there in our bodies, right? The interesting thing I just wanted to throw in is that this isn't new news. In 1863, Dr. Rudolf Virchow, a German physician, discovered back then that cancers could be triggered by infection or chronic inflammatory disease. So we've known this for a while. That's why there's also been research out that says that if you take NSAIDs, the non-steroidal anti-inflammatory drugs, they have been shown to decrease the incidence and mortality of several cancers. And it's because they're decreasing the inflammation in the body and helping. So we know there's stuff there. I think that as we have grown and developed, and the medical field has just done such incredible research and made such progress, we're now at the next stage. This is the next stage of development to prevent cancer, treat cancer, and to prevent recurrence of cancer. So here's some examples. This is examples of inflammatory syndromes that can become cancer, that are increase the risk for cancer. Infections, it can become cancer and increase the risk for cancer. So I'm not going to read through all of these. You will have access to all of these slides. But just as an example, inflammatory bowel syndrome or colitis can lead to colorectal cancer. Gastritis and esophagitis can lead to gastrointestinal cancers. Urinary tract infections can lead to urinary bladder cancers. So we need to be aware of that and try to prevent the inflammatory syndromes, try to prevent the infections, treat them as quickly as possible so that we can prevent the secondary effects, the cancers that can result from them. We know that inflammation causes cancer because one of the things it does is turn off tumor suppressor genes. So we have genes that are there purposely, if a tumor starts forming, to stop it, to suppress it, to turn it off. But if there's inflammation, it doesn't work. Inflammation stops cells from dying the way they're supposed to and promotes cancer cells to grow. Inflammation causes tumors to grow by creating blood supply. We know one of the ways that cancer tumors develop and grow, and some of the research is being done angiogenesis is what it's called, so blood supply that's being given to these tumor cells. Well, inflammation causes more blood to go to the tumor cells. It produces an environment for cancer to grow instead of just the opposite. We don't want an environment where cancer cells will grow. And it actually can cause genetic changes and epigenetic changes. We also know that inflammation affects those adverse effects. So for many of you who have had chemo, radiation, hormonal, biological therapies, immunotherapies, there are adverse effects that can occur with these treatments for cancer. Some of those being cognitive impairment, fatigue, skeletal muscle wasting, polyneuropathy, so the tingling in your hands and feet, vestibular toxicity. So when your vestibular nerve and you have balance problems because of your inner ear has been affected, cardiotoxicity, your heart's been affected, ocular toxicities, your eyes have been affected. Those are adverse effects of the treatments for cancer, and they're all related to inflammation in the body. One of the things, for example, so if any of you have had polyneuropathy, peripheral neuropathy on the bottoms of your feet from chemotherapy, and it can be painful. It can cause swelling and redness and tingling and numbness on the bottoms of your feet. And we know that's inflammation. It's inflammation that is occurring that is causing those adverse effects. So we knowing that, we can do something different, and we can go in and try to prevent it. There are lifestyle behaviors that increase inflammation that we have control over. Chronic infections, we need to get a handle on those, not let those occur. Urinary tract infection is just one of those. Sedentary lifestyles, we have control over that. We just need to get up and move a little bit. Poor nutrition, which I'm going to talk about again, but eating inflammatory foods, blood sugar imbalances, leaky gut syndrome. Our food is medicine or not. It's great medicine for our bodies. It's the best pharmaceutical you can get, is good nutrition that can truly prevent inflammation. Do you know that 70% of your immune system is in your gut? So if your gut is inflamed and it's not working right, your immune system isn't going to work right, and it's not going to allow us to fight off other pathogens or to prevent cancer, recurrence of cancer. Chronic stress is a lifestyle behavior that causes inflammation. Poor sleep habits, the lack of strong social relationships. They now can test for this too, and have. We need a social network. We need people in our life that we love and love us. And there are tests that can actually show the chemical changes that occur. And of course, environmental toxins can cause inflammation in our body. Now, I'm not going to get too deep into the weeds with these tests, but one of them that you might see the most often is CRP. C-reactive protein is a blood marker. There's a lot of different blood markers that can test for inflammation. This happens to be one that they use a lot. So the research that's out there shows CRP levels as much or more than any of the other ones. And so you might hear about this. Even just testing our CRP levels would be great. They're normally very low. And sometimes even difficult to even detect at all, but they increase rapidly with inflammation. So even if we don't know where the inflammation is, if we know there's an increased CRP in our system, it's like, okay, something's going on. And I got to figure out what this is, right? There's been a lot of research showing that CRP is absolutely increased in these cancers. Look at this list of cancers, breast being one of them, but colon, kidney, ovarian, and melanoma, and you can see the rest. CRP is increased in our bodies when we have cancer. And so why can't we have this be part of our yearly physical, that our CRP level gets tested and we see if we have inflammation in our system, or we see if it's going up or down, like I check my vitamin D every year. Other research that shows specific CRP with the breast cancer, there's higher CRP levels associated with breast tumor growth, and it causes decreased long-term survival in breast cancer survivors. CRP is shown up to cause death due to breast cancer or other causes. It's increased in postmenopausal breast cancer in women that are postmenopausal. It's increased with obesity, and then we know that obesity increases the risk for breast cancer. There's increased CRP and insulin and estradiol together that are associated with the risk of breast cancer. These can all be followed very closely. We need more blood testing and blood work and blood markers tested so we can follow where we're at and then prevent it or treat it. It's really interesting too, the CRP, and you can see another list of other markers that are there that are part of this triad: inflammation, depression, and fatigue. We know that we have increased inflammation that can then cause depression, that then causes fatigue. And the higher the inflammation and depression, the greater the fatigue. This particular study they found in breast cancer patients before chemo and up to 4 years post breast cancer diagnosis, they found these high levels, these high blood markers of those listed there. CRP is one of them. We know that sleep problems can cause depression, which then causes fatigue. We know that perceived stress can cause depression, which causes fatigue. And these are all secondary to the inflammation that was caused first. We need to follow this, find out what's going on, and help treat it. So again, lifestyle behaviors that increase inflammation that we have control over. I just talked about this. I want you to read through this again. We have control over these, and we can help our lives be so much better because of this. So what are the interventions that we can do to decrease inflammation? Exercise, exercise, exercise. I know some people hate that E word. So we also use the word physical activity because it's really just moving. Now, there are ways that we can measure exercise. And we talk about moderate and vigorous intensity. And this is where you need to go to your physical therapist, and they will help you come up with your baseline of what moderate and vigorous intensity is for you, because every person is different. All of our abilities are different, and we need to be tested to make sure we are safe when we are exercising. But even before you do that, it's getting up and just moving. We need to be more active. We need to take walks. We need to have an exercise bike in the house, perhaps. Go to a yoga class, go to a Pilates class, find ways that we can be physically active, because that helps in so many ways. And I'll show you some research for that as well. An anti-inflammatory diet, which I'm going to talk about, stress reduction, good sleep habits, healthy social relationships, and avoiding environmental toxins like cigarette smoke and some household chemicals. These are things that we can do. We can start doing this right now, and we can make a huge difference in our lives. We can also help the lives of our friends and neighbors and coworkers, and by sharing in this information, we can go on walks together. So we're helping each other decrease inflammation and then get it tested at the end of every year. We can decrease the inflammation. So how can we do that? It's with exercise and inflammation first. Exercise increases the communication between the immune system and the tumor. Exercise decreases tumor development and growth. Long-term exercise is necessary to eliminate cells that have become cancerous. So remember, it's not just once, it's not once a month. We need to do something every single day, a little bit every single day, in order to make sure that we are providing enough exercise to decrease that inflammation in our system, and then checking it. So here's a study where they did 6 weeks of exercise during chemotherapy. Wow. I don't know how many of you exercise during chemotherapy, but this is what we're really pushing. We want everyone that goes through chemotherapy to do a baseline with your physical therapist. What is your abilities before chemo? And then exercise throughout chemo safely, being followed and by your physical therapist so that they can help make sure you're safe throughout. So they looked at just low to moderate intensity, individualized at home with a walking program. They also did some resistance band exercises, and they tested these 6 different inflammatory markers. Some are pro-inflammatory and some are anti-inflammatory. So we don't want those pro-inflammatory markers to be there, right? Well, after they did just 6 weeks of exercise, the pro-inflammatory blood markers were decreased significantly from pre to post, and the anti-inflammatory blood markers were increased significantly. That's what we want. That is a perfect situation. There was another study that talked about, and again, they used different blood markers. They used moderate intensity exercise, physical activity, and it was shown not only were the inflammatory markers improved significantly, it decreased mortality, it improved longevity after treatment, it improved muscle tissue, it increased weight loss. Then we know we've got the weight loss, so we're decreasing obesity. At the same time, we're decreasing inflammation. 2 for 1 right there. Another study, these are great studies, and there's so much detail. I could talk for an hour about each one of these studies. I bring these to you just so you know, this isn't just something that I'm talking about. This isn't a book I've read. There's great research out there to show that exercise decreases inflammation. This was 53 postmenopausal breast cancer survivors. They had a randomized controlled trial. So 28 were exercising and 28 were control group and 25 were exercising. This was just a stationary bike, 3 times a week for 15 weeks. Significant improvement in blood markers. They found decreased inflammation. Another study with 39 breast cancer survivors, again, randomized. This is with resistance training. So the interesting thing is always with researchers, there's always a lot of question over, well, shouldn't I be doing something aerobic? So, like walking, biking, whatever, or can I be doing resistance training? And this was resistance training 3 times a week for 16 weeks. Also reduced inflammation with blood markers, specifically with a TNF alpha, which is just one of the many out there. But it also then increased lower body strength. That's what we want. Now we're stronger, and we've decreased inflammation in our body as well. Another study with 68 breast cancer survivors where they did 6 months of aerobic exercise intervention, and then another group did usual care, where there was no exercise involved. And there, of course, was walking, and they tracked it with pedometer. Now, the reason I brought this one in, because I thought this was interesting, they got the most significant decrease in inflammation if you exercised at least 120 minutes per week. The women that were under 120 minutes still had a decrease in inflammation, but it was less. So the ACSM, the American College of Sports Medicine, talks about needing 150 minutes of aerobic exercise every week, which that's what we really want everybody to try to do. I thought this was really significant because even 120 minutes made a significant difference. So let's talk nutrition. We love to eat, right? We all love to eat, and we can still eat. And we can eat great foods, and we can feel hungry and satisfied and love our food. But let's be careful about what we're eating. We know that studies have shown If we want to decrease inflammation, we need to decrease dietary acid. The dietary acid load increases inflammation. So how do we do that? We need increased fresh fruits and fresh vegetables and less processed grain and less processed meat, because we need to have more alkalinity in our bodies. The fresh is the key. The fresh is the key. Having a big bowl of fresh fruit in the cupboard. So if you're hungry, that's what you're grabbing. A big bowl of fresh vegetables in the fridge, so that's what you're grabbing. Fermented foods are wonderful. They significantly decrease inflammation. This is again shown with research. They can test for it. So sauerkraut, kimchi, kombucha, I'm a big sauerkraut fan. So I eat a little bit of sauerkraut every day. You don't have to eat piles of it, just a little bit every day. Throw some on a salad. It's great. Curcumin decreases inflammation and blood markers. They found this as well. So let's start using some spices. The more we can use spices in our food, it tastes great and it's decreasing our inflammation. Grape Resveratrol decreases inflammation as well. So get those grapes out. Eat some grapes. I mean, it's wonderful what we can have. Again, fresh. We want them fresh and sitting in our cupboard to grab. One of the things we have to be careful of is omega-3 fatty acids. We need more to decrease our inflammation. So we want wild-caught salmon, herring, mackerel, tuna, all those great fishes. We want nuts and seeds, flaxseed, chia seeds. We want walnuts, pecans, almonds, and the good oils. The only oils that should be in your cupboard: coconut oil, olive oil, avocado oil. Nothing else. If you have any other kind of oils, you need to get rid of them. Eggs and plain yogurt. Plain yogurt is what we want. So again, and I have all the references at the end, so you can look where I got this information. This was another list from another wonderful study where they showed the nutrition to decrease inflammation. Look at this list. This is great stuff. We first of all need a lower glycemic diet. Get rid of that soda, friends, my friends. There should never be soda in your house. Let's drink water. And we can have fun with water, and I squeeze lemon in it. I take ginger and I boil ginger on the stove, and I put ginger in my water so that we're not drinking soda. Get rid of those refined carbs, get rid of the fructose, get rid of the corn syrup, start reading the labels. We need to read labels because there's corn syrup and fructose in everything. It's ridiculous. We need to reduce saturated fat and trans fats and get rid of those processed and packaged foods. We need fresh, fresh, fresh. You know, I know that one of the issues is people will say, I don't have time. I just don't have time to do that. So, you know, we can spend some time talking about how do I work around the whole time issue, and how I do a lot of cooking on the weekend. I love to cook, but I do a lot of preparing on the weekend so that every day I have a week's worth of food in the fridge that I can grab on the run to grab and have a lunch. So I'm not going to a fast food place for lunch. There's so much we can do in that way. Lots of fruits and vegetables. Really, all fruits and vegetables are great, but the best ones are berries. When it comes to fruit, berries are just a powerhouse to decrease inflammation, and cruciferous veggies. So your cauliflower and broccoli and Brussels sprouts, oh my goodness. Now, all vegetables and fruit are good, but I want to throw in there, some people think corn is a vegetable. Wrong. Corn is a grain. People eat way too much corn. Okay, you can have a little bit of corn, but corn is not a vegetable. So let's get that off the list. We need a lot of fiber. There's a lot more research coming out now about fiber too. Things like quinoa, our veggies, our fruit, our nuts are all great. Fiber is what moves things through our system. We need fiber to move food through our system too. Get the what we need from the nutrients from food and move it. You can't eat too many nuts. I mean, unless you have a nut allergy, you can't eat too many nuts. I'm talking walnuts, almonds, pecans, Brazil nuts. Brazil nuts, 2 Brazil nuts a day are your selenium for the day. Peanuts, not so much. So peanuts can be eaten, you know, a little bit, but peanuts are actually legumes. And the reason that there's a problem with them is because there's found to be a lot of mold in peanuts, just the way they're grown and shipped. So you want to be careful with eating too many peanuts. Green and black tea, mung beans are great. And then some of those micronutrients, magnesium, vitamin D, vitamin E, zinc, selenium, all great for inflammation. Now, like I just said, Brazil nuts, 2 a day, take care of your selenium need every day. It doesn't mean that you have to take vitamins all the time, but you have to figure out what you're eating that has these nutrients in it. There's also a wonderful study that was long-term anti-inflammatory diet in relation to improved breast cancer prognosis. They followed these women for 14 and a half years. What a study. Lots of details to it, but I just want to give you the highlights. I loved it when they said a more anti-inflammatory diet after breast cancer diagnosis was associated with lower risks of both all-cause mortality, which is dying from anything, or breast cancer specific mortality, or dying from breast cancer. This is wonderful. Anti-inflammatory diets are really it. And they said after the full adjustment for potential confounders, breast cancer patients consuming the most pro-inflammatory diets compared with the most anti-inflammatory diets had a 34% higher risk of death. So inflammation does make a difference. Inflammation affects how long we're going to live. And we can change how long we're going to live just by the food that we eat. So there's so many great resources out there. This is just one of the wonderful things from Harvard Health that shows some anti-inflammatory foods. There's a couple of websites. I love Dr. Jockers. He has great information, but you can Google anti-inflammatory foods and get so much great information about them. Anti-inflammatory foods are great. The Mediterranean diet is a lot of anti-inflammatory foods, but we really have to be looking at labels, and we want to eat stuff as fresh as possible. Now, another area I just wanted to touch on is what they call advanced glycation and these AGE products. So it's another thing that is being tested now a little bit more and being looked at because this causes inflammation. And it's really, our diet is the biggest contributor to AGEs. It's really the harmful compounds that are formed when protein or fat combines with sugar in the bloodstream. It's called glycation. So you don't have to worry about the details of it, but this really is affected in people with high blood sugar levels. So if you're diabetic, you're at a higher risk for these AGEs. It's also foods that are cooked at too high of a temperature. So a lot of grilling, frying, toasting, not that you can never do those, but you want to keep it at a minimum because they do cause these AGEs. And although we can take anti-inflammatories, we can eat anti-inflammatory foods, and it'll kind of balance it out unless we're consuming too much. So this is kind of a nice little picture that just shows what to avoid. Avoid high processed foods, excessive browning food, high temperatures and dry heat processing. We want low processed foods. We want fresh foods. I want you to make a lot of fresh foods yourself. Low temperature and high moisture processing. We want to avoid obesity and tobacco smoke and those darn sweet drinks and sweets. We want to drink water. Coffee is okay. Be careful about the sugar and cream you're putting in it though. And so you can take a look at this. We know that AGEs, the accumulation of them is also directly affected by all of our lifestyle choices, and it causes tumor growth. When we accumulate too many AGEs, it will increase the tumor growth that we have. There's research out there that shows that the sleep duration can decrease inflammation. So if we aren't getting enough sleep, we're going to have an increase in inflammation. We want to have 7 to 9 hours sleep a night. This greatly affects our survival. A lot of chemical changes occur while we are sleeping. So I know that insomnia, it can be one of the side effects of chemotherapy in particularly. It can also just be a side effect of cancer and other treatments as well. Some of it has to do with stress. Some of it has to do with actually medications that can affect our sleep. We got to work through this. We have to talk to our doctor about this. We need sleep. Such great things occur during sleep. I have to tell you a quick little story about a research project that we did with we had 10 breast and ovarian cancer survivors, and we wanted to do a study with boxing. So, you know, there's all these boxing places you can go to now that are just fun, you know, that you can have, instead of doing yoga, you're doing boxing, you have your own bag. It's just so much fun. So for 8 weeks, we were able to get a group of women. We did some pre and post testing on a lot of different things. We were testing like their strength and stress levels. Anyways, they exercised at least 3 times a week. Well, one of our participants loved it so much. She was boxing 6 to 7 days a week. And we said to her, "What are you doing? Why are you doing this?" She, for the first time in 2 years, was able to sleep at night. She had not been able to sleep since all of her cancer and her treatments. And she would go to bed at maybe, fall asleep at maybe 2 to 3 in the morning, wake up at 5 or 6. She was exhausted all the time. When she was boxing for an hour, 1 hour a day, she started sleeping. She started going to bed at 10 o'clock at night. She wouldn't wake up till 6 in the morning. She felt so good. Even after the study, this is like 3 years ago. I just saw her the other day. She's still boxing. She's still boxing 5 to 7 days a week. We also know that positive social relationships decrease inflammation. We can prove this with inflammatory markers. Oh my gosh. We need to have people in our lives that love us, that we love. We need to get rid of relationships that are causing us stress and find those people that will bring joy to our lives. We know that there are interventions to decrease psychosocial stress and inflammation, things like yoga, Tai Chi, mindfulness-based stress, cognitive behavioral treatment. I talk about these specifically because these are research projects that were done where they actually show the decrease in inflammatory markers with these interventions. Isn't that wonderful? These are wonderfully fun and fulfilling exercise routines as well as stress relievers, and they decrease inflammation in our bodies and make us healthier. So think about getting involved with those. So here's my call to action for all of us. This is for healthcare practitioners as well as survivors. We need to ask for inflammatory markers to be measured. Even if we're only starting with just CRP, we want to make sure that we are getting our physicians, helping them understand the importance of this and that we want to follow it. We want to monitor it regularly before, during, and after our treatments for cancer, and then annually. We want to monitor regularly during structured exercise programs and then annually. So we all need to be in this together. As healthcare practitioners, we need to advocate for this to be done. As survivors, we need to advocate for this to be done. We need to talk to our physicians and talk to administrators and talk to insurance companies and say, I need to know if there's inflammation in my body, and then I can do better. I know that I'll look at what I'm doing and say, okay, I can eat more, I eat better foods, I can try to get more sleep, I can exercise more, I can do better if I know what's going on in my system. Remember, decreasing inflammation not only prevents cancer and recurrence of cancer, but remember that long list? It also prevents other inflammatory diseases like heart disease, diabetes, obesity, autoimmune diseases, and all that long list that I showed you. When we are preventing inflammation in our bodies, even if our thought is, okay, I'm doing this so I don't get cancer, so cancer doesn't come back, I'm also helping every other organ system in my body. Isn't that wonderful? Isn't that wonderful? We need to be doing this for ourselves. So this is my call to action to you to start today. Start today. I want you to start taking a walk. It can just be a little walk, or join a fitness club, or work towards exercising 150 minutes a week aerobically and 2 days a week with resistance exercises, then a little flexibility. Now, sometimes everybody looks at this and says, oh, there's just no way I'm going to be able to do this. So you have to understand physical activity is not about running a mile. It's about, I'm going to take a 5-minute walk around my yard. And I'm going to do that a couple times today. And then tomorrow, maybe I'll do 10 minutes. And then I'm going to call up my friend and we're going to go for a walk. Or maybe I'm going to get on my exercise bike. Or you know what? I've always wanted to join that yoga class. I'm going to try it and see if I like it. So it's just about getting out and moving. It can be little bouts, and you have to start where you're at. And maybe you're only going to walk around the house right now. But eventually, you're going to walk around the park that's nearby, or you're going to go for a trail walk with a friend. We've got to read food labels. There is sugar in everything. Processed sugar, fructose, cane sugar, and there's all sorts of ways that they disguise it, which we can talk about all that terminology at another point in time. The only sweeteners that I use are raw honey, and it has to be raw honey, because even honey, I'm a beekeeper, and even honey gets messed up in stores. You have to really know that you're getting raw honey. That's the real honey from the hive and not fructose with a little bit of honey in it, or fresh maple syrup. Oh, if you can find someplace where they actually make maple syrup, that's the sweeteners to use. When you quit eating processed sugar, your taste buds return and food tastes so much better, and carrots taste like you're eating candy. Eat lots of fresh veggies and fruit. Only the good oils. I already talked about this. Don't overcook your meat. Eat less of it. Sleep 7 to 9 hours of sleep per night. And again, figure out what's going on. It doesn't mean that it's going to happen overnight if you're having sleep problems. Talk to a counselor, talk to a physical therapist, talk to your physician. Figure out what's going on that might be keeping you from sleeping. Nurture strong social relationships and decrease your stress. We have to know when to say no. We have to not be afraid to say no, because we say yes too many times and then think, oh, I'm just so tired today. I shouldn't be doing this, but I told him I would, so I'm going to. Nope, say no. Set more boundaries for yourself. Self-care is crucial. If we want to be around for a long time, to be with our families and our children and grandchildren and our neighbors and friends, we have to learn to set boundaries and do what you enjoy. That's part of that balance. You want to increase the good chemicals in your body and decrease inflammation. Do something that you enjoy. Have lots of references, so you can, look at those if you want to or not. And now I'm open for questions.
Thank you, Deb. We have a lot of questions, so let's see if we can answer some of these briefly, and then maybe we'll need a part 2. One of the questions was, please explain more about low estrogen causing inflammation, especially regarding being advised to take anti-estrogen pills after breast cancer.
Right. Well, and absolutely, and I did too. I was on tamoxifen because my breast cancer was fed by estrogen. And so I was on anti-estrogen. It's just part of, we have a balance within our bodies, and we want our hormones to be at a certain level. And the research has just showed that when you have lower estrogen, lower testosterone in your body becomes inflamed because not everything's working 100%. Part of it is the aging process. That's why I talked about the fact that knowing that, I was on tamoxifen for 5 years, so I know that even lowered it more. I'm aging. I'm 64 years old, so I already have another decrease in estrogen in my system. I'm postmenopausal. So it just is. I mean, that's just part of what they know, that the low estrogen decreases. So knowing that, I'm going to do everything else that I have control of to make sure that I keep the inflammation low. Now, if we have certain diseases that cause low estrogen, those can be, taken care of and increased. Does that make sense?
To me, it does. Another question is, can years of poor nutrition as a child manifest itself later as chronic inflammation, even though diet has improved later in life?
And that's why we need to be tested, because truly, yes, poor nutrition when we were younger can have affected our bodies then, but as we change our nutrition, it truly can change our bodies. We can change what's happening with all of the tissues of our body. We can make our body healthier. Every single organ system in our body can be made better with better nutrition. The chemical balances in our body can be improved. So did poor nutrition affect a person? Probably, but you can change it with good nutrition. Absolutely. Okay. And that's why we need to be tested, so that you can see, is there still inflammation in my body? And if there is, okay, I got to do something about it.
Excellent. Thank you. Another question is CRP usually tested by oncologists during the follow-up appointments after chemo and radiation?
Well, I can tell you around here, no. So I'm from Michigan, and I don't know what's happening where you're at, but it is not standard of practice at all. This is why I'm just on this rampage to get the word out, because we need to make it part of standard of practice. Around here, it is not. Now, I've started asking my patients, I started this a couple of years ago, asking patients to have their doctors run an inflammatory marker panel. And of course, I did have physicians that said, okay, I don't know why I'm doing this. okay, I've never done this before. I've even had labs say, why am I doing this? I don't know why I'm doing this. So it is new. We know the research is there. We have to keep asking. We have to keep asking. And I asked my own primary care physician to run it. And so she's agreed to start running mine too regularly, but it's not standard of practice at all. We have to change what's happening out there.
Good to know. Thank you. Another question is, since sleep is so important, do risks of taking sleep meds like Benadryl, Tylenol, or Advil PM, et cetera, outweigh benefits of better sleep?
You know, that's a really good question, and it's really a fine line we walk. You never get as good as sleep by taking sleep medication. It's never going to be as sound as sleep. However, sometimes you have to get something to make yourself go to sleep because your body is craving sleep. So it's that fine line. If you haven't slept in a couple of days, you better be taking something. But also, we need to work on a plan with you to try to figure out why you aren't sleeping. What's going on in your system? What medications are you on? What stress is going on in your system? What inflammation is in your system that's not allowing you to get a good night's sleep? Or what about your sleep hygiene, the things that you do before you go to bed, and the environment that you are sleeping in? We look at all of those details because you don't want to be using medication every night to sleep, but sometimes we have to do it just to get a night in.
All right. About melatonin, is melatonin okay? Or does it fall under the same thing?
Great. Absolutely. Use melatonin. Absolutely.
Another question is, if I take many of these steps, how long will it take to notice a difference in chronic inflammation?
Again, that's why we need to be tested. I'm sorry, I keep repeating myself because everybody's body is so different. So we can't tell you how long it's going to take to change things. That's why I want on annual checkups. I'm just like, I get my vitamin D tested every year. I get my vitamin B12 tested every year. I ask for it every year because I want to follow this. It's not standard of practice. We want this to be something that we ask and become standard of practice because we don't know. I take vitamin D every day. I don't know what my levels are until I get it tested every year. Same with B12. So that's why we need to be tested. And so we can say, oh, okay, it's at this level now. And if you can get it, if you really are working hard at it, maybe you can get a doctor to test you at 3 months or 6 months to see if this is working. Okay, I'm on this diligent exercise program and nutrition. Let's see if it's working. Hopefully you can get a doctor that will actually order it and see, so you can follow it. And I think a lot of doctors are willing to do that because they want you to get better. They want to help you. They don't know either. You know, that's where we have the proof that we didn't have before.
Excellent. What about household chemicals? What household chemicals are associated with inflammation?
Well, it just depends on what you're using, just even like toilet bowl cleaner, or I'm real nuts about if you have too many chemicals in the house and you're inhaling them when you are cleaning. I mean, obviously we want everything to be clean, but we still need to be careful how much we're inhaling, or we're wearing a mask maybe when you're doing it. Now, just like with the toilet, I use vinegar and baking soda. I don't use toilet bowl cleaner anymore. How strong of chemicals are you using for your countertops or whatever you're cleaning in your house? You just want to start looking at the labels, and if you can cut back and buy something that has a little bit less chemicals in it, the more we can have natural things to clean with, like thieves oil. There's all sorts of cleaning things we can get with thieves essential oils now, which are just so much easier to inhale and so much easier on our bodies. And we just want to be around as few chemicals as possible. Also out in the yard, I mean, I had to, my husband is on a tight leash when it comes to what he can do in the grass. I use vinegar and dish soap to get the weeds out from between the sidewalk cracks and out in the driveway, because I'm not letting him use any weird weed killers that are then I could breathe in. So think about what you're doing in your yard and in cleaning in your house, and And just be careful. We just want to be around as few chemicals as possible.
Thank you. A couple of people asked about secondhand smoke and inflammation. I lost the question, but
hugely an issue. I'll go on with it right now, because secondhand smoke is just as bad as firsthand smoke. We need to be, that is one of those environmental toxins we need to stay away from. And I know it can be an issue if you have family members that smoke, and how do you gently tell them you can't smoke in my house anymore? Or I can't, if you're gonna have a cigarette, you need to go here. Or I know it's tough if there's still smoking around with your family and friends, but honestly, you're the only one that can take care of that. We don't allow people to smoke in our house. We just don't. I don't go anywhere where there's smoke, because secondhand smoke is just as bad as firsthand smoke. People die from secondhand smoke just like they can die and can get respiratory diseases just like they can from firsthand smoke. So it is an environmental toxin that we need to stay away from.
Thank you. We have time for a few more. Are there supplements you would recommend to avoid inflammation? I have heard supplements should be avoided if on certain breast cancer medications.
So that supplements are always, that's like another whole topic that we could spend hours talking about. So it depends on the supplements. There are some vitamins, as the ones I listed, that are really, really good for us. We need to make sure what our levels are. I mean, again, I have my magnesium checked not every year, but every couple of years, because I want to make sure I have enough magnesium in my system. I take that as a supplement. So you really need to sit down with a nutritionist that understands supplements, that understands what your body needs, that can look at your blood work, because just because you had cancer does not mean you can't take supplements. So I want to say that right up front, but you really have to be looked at individually for what's going on with you in your system, what medications you're on, because, and then we have to look at, there's research out regarding supplements as well, and what are safe. So and there are nutritionists that understand all of that. So you really need to meet one-on-one with somebody and go through that specifically.
Okay. What about, I'm not sure if you understand this. What is curcumin?
Oh, curcumin? Mm-hmm.
Curcumin?
So it's just, so turmeric, how many of you use turmeric? And turmeric is a great spice. Oh my goodness. And it is hugely anti-inflammatory. One of the spices that has the most research done. So I put turmeric in food all the time, but you can also buy turmeric tablets. You can actually buy it in a tablet form, because it's a wonderful anti-inflammatory. I mean, it's great even just for joint pain with orthopedic issues, but it is great, and you really can take it on a regular basis just as a preventative as well.
Okay, great. Thank you. We'll have time just for one last question. I apologize, but if you have any additional questions, just email us at Turning Point and we can help get some of those questions answered for you. And maybe we can bring part 2 of the subject, because it seems to be very popular. But last question is, can you please repeat what pro and anti-inflammation blood markers are, please?
Okay, so we have inflammatory markers. So pro-inflammatory markers means they are going to increase inflammation. Anti-inflammatory markers show a decrease in inflammation. So we have different ways of testing inflammation. And we can see if certain markers, if these pro-inflammatory markers increase, we know that there's more inflammation in your body. If the anti-inflammatory markers are increasing, we know that the inflammation is decreasing in your body. So it's just different things they look at. There's huge numbers of inflammatory markers that that doctors can take a look at. The research has been done on to test different things. So, you know, I mean, that's, again, another whole subject itself to really understand every single marker, but does that make sense?
I think so. Good thing we're recording this. So, you know, we'll post it, and, you know, people can go back and watch it and take more notes on it. We thank you. I know there was a lot more questions, and I apologize, but we are out of time for today. Just keep in touch with Turning Point, and we'll most likely bring this subject back. Deb, thank you so much. We've gotten great feedback on the chat box of how much people have enjoyed your presentation and your energy and enthusiasm.
Thank you.
Great presentation. So we appreciate your time spent with us today and helping us with this topic. We want to
Thank you for the opportunity. Thank you.
Yes, absolutely. Thank you. So we'll go ahead and end it. Just as a reminder, Turning Point is committed to supporting the recovery of breast cancer patients through survivorship education. Please feel free to express your appreciation of this complimentary program through a donation at myturningpoint.org if you wish. We now easily accept donations through PayPal, so just another option there. Thank you so much for everyone that came on and supported today's event. Feel free to share this information with others that can benefit from it, and visit myturningpoint.org for our calendar of events to see our next topic is going to be about anti-inflammatory foods, which will complement today's subject. So thank you guys so much. Have a wonderful day. Thank you, Deb.
Thank you.